presents Count on Health.
The short answer is no, so that we know that most fibroids, the vast majority of fibroids are benign, so not cancerous. So a lot of patients have fibroids and have no symptoms. There are fibroids that can be cancerous. So having them doesn't mean that they will become cancerous, but there are some that can be cancerous from the beginning, and those are usually faster growing fibroids. But for the most part, people who have fibroids, they're not cancerous. So want to make sure you follow up with your doctor to evaluate your fibroids, but most people who have them, they won't become cancer. It depends on your history. So at 65, if you've had adequate screening, which means you've had negative Pap smears, and that depends on what kind of Pap smear you have, so I won't get into too much detail, but you can stop if you've had adequate screening for the last 10 years. So a lot of that's hard because people have gone to multiple different doctors and we don't always have records, so it really is patient specific when you get to what Pap smears you have, what records we have, but in general 65 if you've had adequate screening for the last 10 years. If you've had a history of abnormal Pap smears, then that screening is extended usually 20 years from your abnormal or if you had a procedure for an abnormal Pap smear. If you had a history of cervical cancer or a hysterectomy for abnormal cells, then that is usually, you get a Pap smear forever. So it's really depending on your situation, what testing you've had, how often you've had that testing, so we kind of individualize that to each person.